A woman get pregnant at 50 years. Will you be able to get pregnant at 50 years? Omusawogeraldmasssa.com are the names of the channel, both here on YouTube and on TikTok. Will a woman get pregnant at 50 years? Omukyala asobola okufuna olubuto ng'awezezza emyaka 5. In this video, I'm going to answer this question that was asked by one of our friends, and she's asking, can a woman get pregnant at 50 years? First of all, when a woman makes 30 years, there's going to be changes in her ovarian reserves. When a woman makes 30 years, there's going to be changes in her ovarian reserves. Ovarian reserves is basically we look at the number or the quality of the eggs that are remaining. They actually tend to begin to reduce at 30 years. So when you make 30 years as a woman, going onwards up to 40, 45, your ovarian reserves tend to decrease. And of course, when the ovarian reserves or when the amount of eggs that are supposed to make babies tend to begin or they tend to reduce, there's going to be reduced chances, reduced ability for you to get pregnant. So can a woman get pregnant at 50 years? Of course, if at all the ovarian reserves, the quality of the eggs that were supposed to be fertilized started to reduce at 30 years, by the time you make 50 years, you would actually be having very low ovarian reserves. The follicles that are supposed to actually become viable, the follicles or the eggs that are supposed to be fertilized, actually at this age, at 50 years, they would have reduced a lot, in such a way that getting pregnant can only take place if at all you receive support in hospital. You need to go to a fertility hospital. You need to go to a big fertility hospital whereby they will do a thorough evaluation on you, a thorough checkup on you to really assess and see issues in regards to your ovarian reserves. They will look at your ovarian reserves, measure them, see how you are doing. Your doctors at the fertility center might also consider doing other tests, including the anti-Mullerian hormonal test, AMH test, to look at the quality of the remaining eggs. Is the quality good or the quality is not good? Of course, we know that the normal anti-Mullerian hormonal levels is supposed to be at least beginning from 2 up to 9. If at all your AMH readings or your AMH levels are in 0 point something, then it means that the quality of the remaining eggs is actually very poor. Your doctor will advise on what needs to be done. So can a woman get pregnant at 50 years? Only with support in a big hospital or in a hospital she can actually have chances of getting pregnant, but it has to be done in hospital. It actually should be done by your fertility doctor, your fertility expert, whereby they will do all these tests I've talked about, including the anti-Mullerian hormonal test. And then, of course, your doctors might also look at your hormones, because we know that at 50 years, many of the changes, many of the processes that were happening normally when you were in your 20s would have changed at 50 years. The hormones your doctor might pay close attention to include the follicle stimulating hormone, the one which stimulates the eggs to move from the first stage, known as the primordial stage, to the primary, and then of course we get a dominant egg or the dominant follicle which is supposed to be fertilized. So FSH in women at 50 years, normally it tends to rise, it tends to increase. Still, your doctor will be able to advise on what needs to be done. And then, of course, your doctor will also look at another hormone known as the luteinizing hormone, LH. Of course, it is responsible for ovulation. At 50 years, your doctor will be interested in knowing, are you able to actually ovulate, or the chances of ovulation are also very low. Your doctor will use these results of LH levels to really assess and then confirm whether you actually might benefit from from drugs known as the gonadotropins. These include drugs like clomid and maybe letrozole. But remember, it's your doctor to make the final decision. Do not do self-medication at home. You need to go to hospital, and then your doctor will be able to advise on what needs to be done. This video is for educational purposes only. So you need to go to your doctor to do all these checkups. So at 50 years, your doctor will be interested in assessing and knowing how your levels of progesterone are. Your doctor will be interested in knowing how your estrogen levels are, because remember, estrogen tends to actually fluctuate. Progesterone tends to fluctuate, tends to change with age. If at all a woman is actually at 50 years, the hormones tend to change. The normal cyclic endocrinological activities or the normal endocrinological changes tend to actually become abnormal. So at 50 years, can a woman get pregnant or not? It's the name of it's the title, or it's the topic of our video today. With fertility assistance, there are chances that she can get pregnant. But when we are to look at a woman getting pregnant normally on her own without going to hospital, out of 100 women, there was a study that was done by the NIH in the US. They discovered that out of 100 women around the age of 50, there's only one who will actually maybe be able to get pregnant. But still, when she gets pregnant, or when a woman at 50 years gets pregnant, the chances of getting risks is actually much more higher. These chances or these risks include maybe having a child with chromosomal abnormalities or issues like Down syndrome. It is actually much more higher when you are at 50 years. Why? Because the quality of the eggs at 50 years, as I said at the beginning of this video, the quality will actually be poor. So still, there's going to be that risk. And then, of course, there is also a big risk of getting what we call gestational diabetes. At 50 years, when you get pregnant, there's a big risk of getting gestational diabetes, that is diabetes in pregnancy. There's an increased risk of getting high blood pressure in pregnancy. We call it preeclampsia or eclampsia. Then there's also a risk of actually getting a premature or giving birth before the normal time reaches. So much as the risks are there, you still need to go to hospital, sit down with your doctor. Your doctor will do a thorough check on you. Your doctor will do a thorough evaluation on you to really see, do you qualify for maybe assisted reproductive therapies? Do you qualify for IVF? Because if your doctor assesses, and maybe through special checkups like the hysterosalpingogram, the HSG scan, and it shows that if you do the HSG scan, or if your doctor does the HSG scan and then they discover that your tubes are still open, your tubes are still patent, they are still open, then they might actually consider to actually begin treating you. But remember, IVF is another option that can actually be suggested by your doctor. IVF specifically means in vitro fertilization, whereby this is done in big facilities, big hospitals, big fertility centers. Wherever you are watching this video from, you need to go to that hospital which is specific for fertility issues, and then your doctors there will actually advise you on IVF, whereby some special medications will be given to you to actually mature your eggs, and then after some time these eggs can be retrieved. We call it egg retrieval, and then fertilization can take place, of course still in hospital, and then the embryo or the embryos that have been isolated will be transferred back to your womb. We call it embryo transfer, and then of course implantation will actually take place, and then monitoring and close supervision will be done in hospital. This video is for education purposes only. You need to go to hospital to actually get proper treatment by your fertility expert. So at 50 years, will a woman be able to get pregnant or not? The chances are very, very low, but you actually should try, because in life, if you do not try anything, you may not know whether it could have worked or not. So you need to go to a hospital, talk to your fertility doctor. They will do a thorough checkup on you, and then they will advise you whether you qualify for treatment or not, whether you qualify for IVF or not. you can actually ask your question just as our friend asked a question. You can go to the comments below this video and then ask your question. You can also visit my website omusawogeraldmasssa.com on Google. It's across here. Visit and then book to consult me about fertility. Have yourself a great day. Let me see you in tomorrow's video. Remember to ask your questions, like, follow and share this video with friends who might actually benefit from this information. Thanks a lot and have yourself a great day.